Hi everyone, my name is Brasg. I'm one of the infection doctors here at Humber River Hospital. I've been at the hospital for just over 3 years now, and in addition to my role, I'm also the medical director of infection prevention and control, which makes it very timely for me to be talking about Lyme disease. What is Lyme disease? Lyme disease is a bacterial infection that is transmitted by black-legged ticks, which are also called deer ticks. Only certain types of the tick can transmit the infection, and basically once the tick latches on and bites you, which by the way is usually painless, the bacteria slowly makes its way to the mouth of the tick and gets into us. Usually that takes at least 36 hours. So if the tick has not been attached for 36 hours, you're in the clear. Typically, what most people get with Lyme disease is what's called erythema migrans. What that means is a rash that typically starts at least 3 days after a bite, more commonly about 7 to 14 days. And it's typically large, red, not particularly painful. You might not even notice it if it's on your back, for instance, unless someone else sees it, and it slowly grows over a few days. Very rarely people will also get muscle pains, joint pains, fatigue, and headaches, kind of that viral flu-like symptom constellation. And if you're unlucky, unfortunately, Lyme disease can also affect the heart, nervous system, and eyes. And all of that is considered early Lyme disease. Now, generally, if you go untreated after that time, you can develop what we call late findings of Lyme disease. Usually that would be arthritis, so painful, swollen joints in the body, and other problems with the nervous system. But thankfully, those are quite rare at this time because we typically get people the treatment they need when they need it. So, ticks are usually found in wooded areas or areas with long grasses. Unfortunately, we know from recent data from Public Health Ontario that infected ticks are found throughout the GTA, particularly and certainly in Northwest Toronto with our wonderful rivers and parks as well. So very important to be mindful of ticks when entering those areas. Now, what can you do to prevent yourself from getting infected? Well, ticks do not like light, bright colored clothing, so we generally recommend wearing that. Ideally long sleeved. Shirts should be tucked into pants, not like what I'm doing right now, and pants should be tucked into socks. Now, bug spray is always a good idea. We recommend either DEET or icaridin. And generally sunscreen should be applied first and should be allowed to dry, generally 5 to 10 minutes before applying bug spray, which should be on the outside. You can also treat your clothing with another product called permethrin. Usually we would only recommend doing that if you're planning to be in an area at risk for a number of days, like camping or hunting. Now, after leaving an area at risk, we always recommend doing a tick check, so checking all the possible affected parts of your body for ticks, which by the way can be very small. So the tick that transmits Lyme disease can be as small as a poppy seed to a sesame seed after completing its feed. So really very small. We want to be looking at all parts of the body in the skin folds, the elbows, the underarms, behind the knees, as well as the belt line, because these are the areas that the ticks really like to affect. Generally, we also recommend taking a shower or even throwing your clothes in the laundry and the dryer to help reduce that sort of tick population, which might still be on the clothing. If you do find a tick on your body, don't fret. You can remove it, generally with some tweezers or a similar product. You want to squeeze the tweezer as close to the skin as possible. So we don't want to be squeezing the actual body of the tick and then just remove vertically in one smooth motion. We're not sure, but we think if you actually squeeze the tick itself, you might actually push the bacteria into the body, which is exactly what we don't want to do. Now, if the tick is attached to your body, it's been there, we think, for more than 36 hours, you should seek medical attention. And the reason for that is not that you're certainly going to get Lyme disease, because we don't know, but that we know that a single dose of antibiotic can actually prevent you from getting it, and seeing your healthcare provider can get you the treatment you need. Some last points that I think are important to know. If you have the classic rash of Lyme disease and you've been in an area that is known to have ticks, you don't need any blood work or special testing. We can diagnose you just based on that clinical picture and get you the treatment you need. If you do need testing, either because you want it or your healthcare provider thinks it's appropriate, we recommend going to the provincial lab. There are a number of private labs that are not accredited that sometimes give unreliable results. So it's really important with Lyme disease to have confidence in the result. Last thing is that, unfortunately, 2 more tick-borne infective illnesses have appeared in Ontario in the last few years, called anaplasmosis and babesiosis. Unfortunately, they can transmit very quickly after a tick bite, and they're all the more reason for us to nix the ticks. So take care out there. Thanks for chatting.